Welcome back, everyone. Dr. Naveen here. Sorry for keeping you waiting. We're ready to go now. We have around 28 aspirants now who is part of this thing. Uh, Please help me by pinging in the chat box whether the audio and the screen which you're seeing uh, are okay. Is there any disturbance or not? Please report it in the chat box. What we'll do is in the first 15-20 minutes, I'll just give you a brief strategy for the upcoming mains exam, which is in 90 to 100 days. We'll start with the basic strategy first. And also, I have been in conversation with many of the aspirants because I'm also adding them in the WhatsApp group, as we all know. So they have come up with some specific questions. I think if I discuss them in the initial part, that will answer most of your doubts. So once we're done with 15-20 minutes of rapid discussion, I'll give you Q&A time, the question and answers. You can ask me any specific doubts about your strategy, because we all know that one size does not fit all, right? So each individual needs own specific strategy. So for that also, I'll personally help you. So before that, I want to give you basic strategy, and also whatever experience I have with last 3 years of mentoring toppers, I'll share those things here. So if there is any disturbance and all, you can just raise your hand, or you can type it in the chat box, or you have an option to unmute yourself and ask a question. Okay, so we'll start with, yes, target 2023. I think exam is around 15th September, right? Tentative date, or the scheduled date. So maybe after 7 to 10 days, probably you will have your optional exam. So this discussion is purely centric on optional preparation, because you're all medical science optional students, and we all know doctors can do it, and doctors have done it in the past. So there are some few important success mantras are there that you need to understand here. Many of you who spoke to me personally, they all know all these important things. I want to put them together. If you miss out on one or two things, see, there are 4 important things that you need to do in the next 100 days. Okay, you have 100 days now to give your best in your life. See, after the mains, there will be an interview. After the interview, by the time the results come, the next prelims is almost there, right? 7 days before the next prelims, you will be civil servants. So only these 100 days are most valuable days, productive days of your life. And the earlier you start, the better the results are, because I have seen many of the students wasting time in till the results. It's been almost 14 days after the exam till the prelims results, right? I personally feel even those 14 days are also important, but looking at the complexity of prelims exam, both GS is fine at the end of the day, but CSAT and all had made life even worse. So we already wasted 14 days of our life. Now we have only 100 days to give our best. So we'll start with 4 success mantras. I'll tell you why these are important with practical examples. Okay, and also later on, once we know this, I'll give you strategy under each heading. So with that, we'll conclude what UPSC Medico and Dr. Naveen gonna help you in these 100 days, in what way. Let's do it together. So what are all the things that you need from me as an additional help? Okay, we'll also discuss that. Then we'll conclude with Q&A. Let's quickly start with the first mantra. We all know this exam is a game of balance. So you have to balance now the general studies and the optional part. People who can balance this, okay, who can balance this, we all know optional carries 30% of the weightage, and the GS carries 70% of the weightage, including interview part, based on 500 marks. You need to know how to balance your optional preparation along with GS in this 100 days. So many of the students, they start with optional, they end up scoring well in optional. In the process, they lose grip on general studies. So in the later part of their preparation, in 50 days or 40 days, the preparation becomes cumbersome. They can't handle that stress and pressure. So they end up giving this attempt altogether. And as a loser, we start thinking about the next year attempt. Okay, so it's very important that you balance. So how to do that balance, I'll help you with that. And second important thing is, many of us, we not only for medical science optional exam, be it be NEET, PG, next or INSET, doctors, we always think in the lines of beating the exam. So what question gonna come, how to answer it, how to beat the examiner or paper setter. We all have that mindset. Let me master this optional. Let's score 500 out of 500. Let's not get into that myth zone. Okay, it is not possible to beat the exam because examiner himself has resources to set a paper, right? He's also a human being, but he has access to everything. But for you as an aspirant or an exam taker, you have limited space and limited time to attempt it. So you are competing with your competitor, not the exam. So you need to learn how to beat your competition, not the exam. This is second important success mantra that you need to understand. And third important thing is, as doctors, we always thrive for sense of completion. And that I always tell my students that you are never ready for this exam if you keep on probing for things, if you keep on going for value additions, if you keep on learning new stuff. Revision becomes tough. You look at many of the topper interviews, they all say that revise more and also practice more instead of learning more. Okay, you need to have a borderline or a boundary or a zone. Within that zone, whatever resources you have now for the next 100 days on the table, just look at your table, whatever is there already prepared, whatever the weapons you have. I think the war is already started. Now it's time to take that weapon and fight the war. Instead of doing that, many of us ending up sharpening the weapon or altogether preparing a new weapon when the war is already started. So there are high chances that you fail or die in this war. So whatever you have on your table, now look at the table and see, okay, these are my weapons for this war. You have to use them meticulously, okay, in a smarter way so that you can win this war. So instead of doing that, if you thrive for sense of completion, value addition, learning new stuff, you end up on the losing side. So learn less, revise more. Practice makes you perfect. It's time for practice. Many of the toppers who cracked it, they say in this 100 days we were just writing. They just do answer writing because it's a game of answer writing. Okay, you won't be watching a number of videos, or you won't be having a philosophical discussion or group discussions in the exam. This exam is purely love between you and your pen. Okay, so how that pen gonna work for you on the day, on the paper, is the war here. Okay, only three of you, your pen and your paper. So these are the three important things that should be there in your mind. Rest all is a waste of time for you. So practice more, start loving your pen, write it on the paper, and improve your answer writing. This is very important. But what we do, we always stay in our comfort zone. What is our comfort zone? If you open your book and if you start learning, you'll feel confident. Mera ye ho gaya hai. I'm done with this book. So let me go to the next book. Then, even this is done. Oh, so I'm going to the third book. So you keep on taking these short notes. So what happens when you do that? You have this reward system working very fine for you. But when you have to take your pen and write it there, then the problem starts. You won't find that reward there unless the evaluation comes or unless you are the topper of that. So in the process, you miss out on very important thing, that is answer writing. So don't do that mistake. Come out of your comfort zone. Get out of your comfort zone. Your comfort zone is learning. Don't do that. You have to get into the practice mode and writing. The more you write, the more chances you have to succeed in this exam. And this is the point, not by me, Dr. Naveen. Many of the toppers who are your colleagues and seniors, they have done it, and they say that answer writing is the key here. Okay, so these are the four important things that you need to keep in your mind before going ahead. So balanced preparation, law of average works here. Okay, I see some students, amateur students from doctor fraternity, just passed out MBBS students. They are of an opinion that yes, I'm a bright MBBS student. Let me get 350. Or let me even get 380 so that optional will come to my rescue. So then I can ignore either ethics or essay which I am poor at, or I can, let's see, okay, even if GS3 goes, let me do well in the paper 4, or let me crack the interview, then I can be a topper. So these kind of exceptions does not work in this exam. Okay, we all know at the end of the day, the total marks of any aspirant, even number one, rank number one, will not cross 1100. Okay, it's all about balancing everything. It's all about law of average. You can't be master of one and an amateur in another. You have to be a pro in all the subjects to crack this thing. So give due diligence and respect to all the disciplines of your learning, starting from general studies, even language paper. It's okay, even if it is of qualifying nature. And also very importantly, the optional part, you have to give due respect to each thing. And I have seen many of the students, they fail to give proper time allotment for the medical science optional. So when you are writing it for 500 marks, it is 30% of the weightage. I think in the next 100 days, if you are not giving more than 30 days for your optional, the optional will definitely fail you. Okay. So even if it is medical science, even if you are master of medical science, in this 100 days, you should spend at least more than 30 days on optional. When I say this, you might feel that, array, what about GS? There's so much to complete. There's so many tests and all. I'm not saying that the whole 30 days, 30 into 24 hours, maybe 12 hours, maybe 10 hours, according to your potential, at least 300 hours. Even if not 300 hours, at least 200 to 300 hours should go for optional study. Okay. You have to stay in this zone. And for students who haven't prepared optional yet, who are starting now, who are not optimistic about this attempt, but somehow luckily they cleared prelims, now they want to do mains because they haven't given enough time for pre-prelim preparation of optional. This 30% should go to 40 to 50% now. See, very important, because at the end of the day, when you look at general studies, the pattern of the paper, okay, how the weightage of the marks, and also the scoring trend in last 5 years, hardly people are mastering it. Many of the aspirants, they stay in this zone of 90 to 110. Okay, it's not easy to master a general study altogether. If you spend enough time in the optional, there are more chances that you can score better rather than spending more time on general studies, because general studies is very vast. It's not limited syllabus, and we don't know what kind of a paper it comes and what kind of surprise or bouncers that can come in a particular paper. So you are never ready for that miracles. But optional is pretty static portion. If you can master it, it is easy to improve 20 to 30 marks now in this next 100 days. Okay. So improving marks in optional is more easier than improving marks in general studies. And this works for those students who have just started their optional preparation. They might have done some homework, but they're not confident and they haven't given any test. So for them, I think allotting 40 to 50% of the time for the optional works. But for those students who have done some pre-preparation, who has revised it once or twice, and who has given some tests, it's okay to give 30% or 300 hours. Okay. But please give at least 250 to 300 hours. Never ever ignore your optional. I have seen many of the toppers last year. We are 19 plus in the list, 19 plus in the list. But when you look at the scores, they average in the range of 260 to 287. Now you see, many of the students who cracked it are in this range, but many of you who are giving it for the second time, you are lying somewhere in 242 to 260. Now, to get into the list, you have to improve at least 40 marks. Okay. And exactly 40 plus marks improvement is done by Dr. Anjali Garg from last attempt to this attempt. So I spoke to her last year after the prelims till mains. She wrote some of the tests. She followed my advice and she was very happy. And she told it in the interview that I was able to improve 40 plus marks from my previous attempt by following these steps. And many of us are having an opinion or a myth that if I spend more time in medical science optional, it will also hamper or affect my GS preparation. Or if I spend more time on GS, it will affect my medical science optional. So let me take a chance in one of the things. So never take a chance. Give due respect to both the things and do a balanced preparation. You will definitely succeed. Okay. So balanced prep, law of average is not my mantra. It is told by almost every topper interview in the YouTube. You can just go and check there. Okay. So now what you need to do is you have to target 40 plus marks improvement from your previous attempt. Or if you are giving your exam for the first time, it's very important that you should target to score 300 plus. So when you write it on the paper, there are high chances that 40% more chances that you can do it. Okay. Now take a sticky note right there. Let me score 300 plus in my optional and paste it somewhere on your wall. Okay. For next 100 days, just look at it and work hard for it. Optional is your savior. Optional can rescue you. And many of the brilliant students who couldn't perform well in the optional are not in the list, and they have to start their war altogether. So never ever ignore your optional. Give due diligence and respect to it. Spend more than 300 hours and score 300 plus in optional. You will be in top 100. Okay, mark my word. And you can happily improve from your old attempt to new attempt 40 plus marks if you follow whatever I tell you now. Okay, so the first thing is balanced preparation, and in the process you might feel like giving up. Please never ever give up. We all know fortune favors brave. It's okay even if you cannot complete whole of the syllabus. It's okay even if you're half prepared, but at least half preparation is better than nothing. So what we do on a very bad day, when we couldn't finish our micro goals or mini goals, we end up losing confidence and we altogether leave this attempt. So don't do that mistake. Just stick to it. Stick to it. We all know, even I have some practical experiences in life. So if you keep on reading till the exam, most of the time the 3-4 questions will come from that previous 2 days only. So then you'll feel confident. Array, just I read this in the last 2 days. What it would be like if I didn't read this? Oh my God, I did well. So this is how the mind works. The more you stretch the till the last date of the exam, if you keep on your strength and keep on revising, and that's what is brevity, and the fortune always favors brave people. So never ever give up in this 100 days. Also write this on the sticky note. Fortune always favors brave. So be brave, be confident, never ever give up in this 100 days, because out of 15 lakhs people, only 14,000 got selected, and you are among them. Look at the ratio. Out of 15,000 aspirants, I think 10 lakhs might have, 15 lakhs, 10 lakhs might have given this exam. Now, in the list of 14,000, you are there. If you utilize this 100 days perfectly in your life, I think you will be in the next list of 1,000, 14,000 to 1,000. So that only happens if you don't give up, because each one of you, the whole 14,000 people who qualified prelims, they only have 100 into 24 hours. Okay, so the time is on a level ground. Now how you utilize number of hours is more important. So each hour is vital for you. Never ever waste even a single hour. Think that these 100 days are your best days. Give your best practice. I think if you do not give up, definitely the fortune will favor you. And why I'm repeating this word of fortune, because we all know it's a game of luck. Because look at the level of the competition. Even passed out students, even all India rank 1 will also say that I never expected this. I feel lucky. So this luck only comes with brevity, with confidence. Okay, give your best attempt. This will happen. Let me quickly tell you, as I already told you, you have to beat competition, not the exam. Okay, so you almost 90% or 95% of your competitors are again UPSC Medicos, right? Because you are all a part of UPSC Medico now. Now your content is same, your approach is same. Now how to bring in that difference to beat your competition? So one way of beating your competition is discipline. Why I'm saying this discipline? You open the test series and see the topper column of last year. So though we have 18 plus students who qualified, I posted only the papers of, I only pasted papers of Dr. Anjali. What about the remaining students? They have hardly attempted 1 or 2 papers. Okay. Hardly attempted 1 or 2 papers. They were not serious enough to complete the whole test series. Okay. And also very importantly, if you observe the topper copies in the last 3 years, Dr. P. Srija, Dr. Anshupriya, and Dr. Anjali Garg, who are the toppers from medical science, you see they have finished most of the subject-wise tests. So I think this is a kind of a practical example for you, like how to score good in medical science optional. It only comes with answer writing practice. So make sure that you're disciplined enough to finish off all the subject-wise tests. See, 60 to 67 students I have added in the group for strategy. Okay, now 28 have are attending this session. Okay, even if 1 point is valuable, even if 1 point can make difference in your life, I think you will be the winner. Okay, this is how you have to wait for your opportunity, by being disciplined, right? So you see already 30% people are missing on some vital points here. So you are in 28. If you finish test, maybe 20 people or 15 people will be doing all the tests. They will be in the list. So this is how discipline and hard work works. When you open a topper interview and listen to them saying that I was persistent, I was disciplined, that sounds a ready-made statement. But actually, the success mantra is that if you're disciplined enough to finish all the tests, definitely you will be in the list. So, okay, that is how you can beat your competition. And second important thing is bring in some improvements in presentation. I might give you one slide or one image. Try to modify it on the day of the exam or on the day of the practice exam. Try to improvise your answers, bring in some new stuff, current stuff from current affairs and all. Okay. And also never ever miss out on previous year question topics now. It's okay. There will be some odd questions, 4 or 5 questions, and there will be some odd questions in question number 1 and 5, which are actually very important for you to answer. 1, 5, right? In the paper, 1 and 5 questions are mandatory. In that, the first question itself or any part of the 10 to 20 marks of the paper, they're trying to make sure that the same topic is asked in a tricky way so that you will be forced to commit mistakes. So they're trying to kind of test you in that segment. But this challenge is for everyone. You don't need to worry about the rarity. So the remaining 30 to 35 marks, I think you should score full. So that's the success mantra. So make sure that you finish off common things. You read previous year question topics. Almost 90% of the paper is repeat. Okay, mark my word. I have analyzed each subject, each final year paper starting from 2019. You can check in my YouTube channel. In all the papers I had seen, hardly 4 or 5 questions are out of the thing. Remaining all are out of the thing in the sense they are within the syllabus, but not from previous year questions. But remaining all are the previous year question topics, not direct questions, but they are repeat of the topics. So I have given you a list of 110 topics which are most frequently repeated in the last 21 years of medical science optional. So this vlog article is there in UPSC Medical website. So please look at this and make sure that these 110 topics, you are perfect at these 10 topics. Okay. So try to master them. So common things first, rare things. If you want to learn, it's okay. But I'm not a fan of teaching you rare things. Rare is always a rare. That is never a deciding factor because your purpose is to beat your competitor, not the exam. Okay. Don't try to bring glory to medical science. You are here not to become a doctor. You are here to become an administrator. Just use the help of medical science and get away from here. Okay, so beat the competition, only read common things, rare is rare, do not miss out on PYQ topics. And these are all the things which are told by Dr. Akshita, All India rank, I think around 60, and Dr. Anjali Garg, All India rank 69. They are all the toppers and they did it. They were not learning anything new. They were improvising on the commoner things. If the same question comes, they're giving their best presentation. So they're working on commoner things instead of learning rare things. This is very important. And next thing is revise more. Do not try for sense of completion. Stop making any value additions from now. Whatever you have, just bring in satiety with that. Okay, don't be so hungry now. This is not the time to do value additions. Maybe before prelims, you could work for value additions, but this is not the right time to make value additions at all. Okay, and very importantly, I want to tell you 2 important things here. One is practice this active recall method. Okay, this has worked for many of my students. They're now happy because the problem with medical science is in comparison to general studies, when you start revising or suddenly after prelims mode. What is prelims mode? You might be solving a lot of MCQs and having fun with current affairs, but now suddenly you have to open your old dusty books and start reading medical science again. Suddenly what you see is the syllabus is bulky. The syllabus is huge. Nothing stays in my head. I forgot everything. I am no more a doctor. So these kind of negative things, they will creep into your brain. Okay. Now what you need to do, for example, if you're starting fresh now, okay, just close your eyes. How this active recall method works, there are 110 topics. When I open anatomy 110 topics, the folder in the UPSC Medico, the article in the anatomy, first topic I see is placenta. Okay, so placenta, there are almost 15 times the placenta question got repeat. Okay, so what is the most common thing they're asking in placenta? So what are the anomalies of placenta? Okay, anomalies based on shape, anomalies based on the number, anomalies based on the position. So what are the images? So try to think about placenta. Try to think about placenta because the same question can come for 5 marks, 10 marks, 15 marks, 20 marks. 15 and 20 marks were the old trend. Maybe 5 years, 6 years back, we used to see 20 marker question or 15 marker question. Now the questions are being pretty specific. So it may be in the range of 5 to 10 marks. Now close your eyes. Don't read anything or don't open any book. Just think about the placenta. try to think about 5 important points of placenta. So I'm doing that active recall method with you now. So placenta means I need to give a definition. What is a placenta? From syncytial trophoblast or cytotrophoblast? Where does it form? What is the decidual layer? What is the maternal layer? So where does it implant? So these are the things here. What is the structure of a placental membrane? How to draw the structure of a placenta in the exam? Just practice that. And after that, okay, what is this succinturate lobe? Okay, what is this bipartite placenta? Okay, there are many. What is this placenta previa? Okay, abruptio placenta. So there are a lot many things which are in relation to placenta. Think about that in an active recall method. Then open your notes or the content whichever you have and see what you have recollected and underline them or highlight them. Okay, highlight them in different color. Okay, when a question comes, these are the 5 important things that you need to know about placenta, or 10 important things for 10 marker question. So this is how, if you do 10 topics per day for next 100 days, okay, not even 100 days, I think if you go for 5 topics for next 50 days, okay, you can happily finish almost 250 300 high yield topics from medical science. Even if you don't want to do a complete recall of the UPSC MEDICO notes, which contains more than 300 topics, just select these 110 topics. Okay, at least do 2 to 3 topic active recall per day. At least in next 50 days, you will finish off active recall of 110 topics. When you do this active recall, what happens? You are never worried about forgetting the things. Now, at least you did this active recall. Now, you know, at least 5 to 10 points in the exam. At least I can extrapolate this. If you have a closed web, okay, slowly you can untwist it, right? So this is how the DNA is packed in the cell. In the similar way, you have to pack your content in the brain so that whenever the headlines open up, whenever the keywords open up, you can write little bit more about that. So this is how a zigzag pattern works in the brain. If you follow this active recall method, I think at least you're no more worried about revising a bulky optional like medical science. This is one important thing I want to tell you. And second thing is focus on 5-day revision book. What is this 5-day revision book? So 5-day revision book is that book after finishing your mains, the 3 days of exam after 15 September, you have 5 days for language and 6 days or 7 days for your optional exam. So in these 5 days, people are finding, students are finding it difficult. They're going blank. They're losing hope. They're thinking that it's not medical science. It's a hammer on the brain, because you're already drained by the general study exams. After that, coming back to a static optional like medical science, you might feel it fishy. So in this 5 days, what you need to do is, so whatever you're doing in next 90 days, okay, always think about, let me post this content for this 5 days. I might forget the movements of the hip joint. I might forget the muscles which are producing movements of the shoulder joint. Or there are high chances that I might forget the factors which are controlling cardiac output, or exercise induced metabolic changes. So these kind of topics which are dictums, for example, functions of the basal ganglia, whatever you do, you might forget that caudate nucleus putamen in the end. There are some topics in this 90 days, you will feel that there is risk of forgetting these topics. So make a list of these topics, or highlight them, or bookmark them, or do something so that you will be focusing only on those volatile things in the 5 days. So that is your focus on 5-day revision book or a volatile book, which you should think of now. Okay, if you start thinking about it during those 5 days, definitely you will be anxious. Okay, definitely you will lose the war. Think about that 5-day revision book from today itself. So if you read something today, make sure that this topic should be there in my 5-day revision book. Otherwise, high chances that I might end up losing it. Okay, so this is the one important thing. And last 5 years of papers you already have with UPSC Medical notes, and also 2020, 21, 22 papers have been given. Just revise them. It's very important, because every year I had seen almost 60 to 65% of the pre-IQs are coming from the last 5 years itself. So that gives you a sense of happiness or confidence while writing the exam if you see the same question. Okay. So as I said, start writing. You're never ready for this exam. So I spoke to many students. There is a 7-day schedule. Okay, today you have to start revising the subject. So on the 7th day, you have to give your exam. In 7 days, sometimes there is anat plus physiology test. I think the syllabus is huge, but intentionally or wantedly I have put these two subjects together, because if you give 7 days, 14 days, 28 days, it doesn't make any difference. They are bulky subjects. You might end up learning a lot which is not needed. So when you have 7 days of time, plan in such a way you finish all the high yield topics and you're ready for this exam. Okay, writing exam is more important than completing syllabus. Writing or attempting your test is more important than finishing of the syllabus. And as a UPSC aspirant at this stage, I personally feel you are never ready for this exam, right? You all know there's so much to learn. So start writing. Writing an exam is more important than completing the syllabus. Never try to complete the syllabus. Only focus on high yield areas and do smart study. Okay, smart study. Pick the topics. Anticipate the future topics. Based on the previous year paper, this might come. This may be a probability. Let me focus more on this. So this is how you have to double guess yourself. That is smart study, and you have to finish and you have to start writing. And as I told you, work on presentation, improvise your answers, practicing images. Hardly 7% of the papers contains images. This is actually a fact, a stat from UPSC Medical answer evaluation. I have evaluated almost 1500 plus papers now. Not more than 7% of the papers contain images. Rest of the papers, more than 50% of the papers, they're full texty, essay based, paragraph based. There's no heading, there's no introduction, there's no highlighting. Okay, so how to write your answers, how to master your answer writing, I have already recorded almost a 2-hour video in the test series. If you haven't watched it, please watch it in 2x. It will only take 1 hour of your time, but in that video I tried to cover almost 60 or 70 important points which I learned in last 3 years of evaluation. Okay, so very important. Watch this video. These are all the points I covered. How to give introduction, what is the way to present, what is the way to conclude your answers, how to approach clinical paper, how to approach differential diagnosis, what are the miscellaneous points, from pharmacology, how to improve your score, and also how to choose 5 out of 8 questions. I think these are mind-boggling things for you now, right? Before starting your answer writing, the schedule 2 has already started. So from Monday onwards till next Monday, you have 7 days of window period to submit your format test. So go through all these things before starting and follow all these tips and tricks. If you follow this, I think easily you can improve 20 marks on your performance. Okay, so this is very important, and I have recorded my experience in 2 hours of video. If you fail to watch it, I think this will definitely affect at least 10-15 marks from you. Okay, so do watch it, do utilize it. It is there in the test series column. Okay, test series column, general column, there is a discussion video on how to approach an optional. All the points which I just shown you here are there. I don't want to discuss them again and waste your time. The video is already uploaded there. Now, as I said, time management is the key. So time management, you have to finish your exam in 3 hours, and you can only manage your time by practicing it. If you don't write tests, if you think that there's no time, let me focus on GS, medical science is my friend, so it will definitely save me. So let me focus more on GS. So you will end up getting good in GS, then you will start blaming medical science as an optional. Not only one student. You look at the Dr. Aditya. Okay, Dr. Aditya called me after prelims. Okay, Dr. Aditya, who is ranked 70, I think. Yes, Dr. Aditya called me after prelims. Okay, I asked him to write the test. He's just passed out student. He hasn't done enough answer writing with GS. So what he did is he focused more on GS. He hasn't submitted even a single test. Okay, he scored 250 in medical science optional, but still he was able to score rank 70. It's okay, but he's an exception. You can't take inspiration from him, or you can't extrapolate his result to medical science saying that he is a good topper, but still medical science failed him. No, he hasn't written, he used my notes, but he hasn't attempted any test. Okay, he hasn't paid that respect that medical science needs, and he was a bit unhappy, and he called me and said, sir, aisa ho gaya medical science mein. I asked him, it's okay, let's do an interview. Still he said, sir, this is not right. I could have performed well, at least for your sake. You told me that I should write tests, but I ignored. So this is words of a topper. Okay, you have to practice. You take other scenario. Dr. Anjali Garg, she scored 240 in the last attempt. It's her second attempt. So she realized, if I don't do well in optional, I'll be thrown out. She got, I think, rank 79 with a score of 287. Now you see the difference. Now answer writing will definitely give you 30 to 40 marks extra. So though you don't have time deficit, please finish off all the answers, write all the tests. So all my toppers who are in the list or who are in the test series column papers uploaded, they all practiced it. So it's a proven fact. So do practice them, And if you don't give enough respect, don't blame optional as a whole. Okay, I couldn't upload any other paper because I couldn't see good paper there. If I can't give you good marks, how will the board will give you good marks? Okay, you take any of the topper who is in the list. his marks matches with my average in the subject wise test. You take Dr. P. Srija, her average mark in all the tests is 301. She scored 298. You take Dr. Diksha Doshi, she attempted 6 or 7 tests. Her average score was 270. She scored 272 in her final exam. Okay, this is how they score. You have to target at least more than 150 by 250 in subject-wise test to get into that 300 zone. If you don't do it here, how come you expect an examiner to give you good marks in medical science? So let's stop blaming medical science as a whole. Let's practice it. Let's try to get the 20, 30 marks extra. It needs commitment. Okay, it needs commitment. Go and see how people with other optionals are preparing. They even do daily answer writing. They do 500 hours of video lectures. Okay, and those people are kind of brushed on with the optional, and they end up scoring good in optional, still not in the list. Okay, so they're losing the game of balance just in the search of glory to their optional. You are not here to bring glory to medical science. You are not here to make medical science the best optional in the industry. Even if you don't do it, I'll get 1,000 doctors per year to run this. Okay, even I don't want glory for medical science. What I want is your graduation knowledge of 5.5 to 6 years should be put into right use. What's the point of you being a doctor and choosing something else and losing the game altogether? Okay, so optional will give you good marks when you practice it more, when you give due respect to it. Let's respect our optional for next 100 days. I'm here to help you. Let's do it together. So I have given you already schedule with 7 days gap in between. Follow it with live GT. What I'm trying to do is you lost touch with medical science. You don't know what is happening in the world of medicine. But let me be very frank with you. There's not many updates that will affect your preparation, but there are subtle things like national health programs, management guidelines, new national health program, our new TB update, new drug update, our new guideline for management of MI, our pulmonary embolism, our GINA guidelines of asthma, any new radiological sign in the investigation of surgical conditions, or any new surgery for gallstone, or any new robotic or laparoscopic method, any new modality for management of the varicose veins. So these are only the superficial things which you are missing. The core content, it remains same. So you don't need to worry about any update that happened with medicine. But if there is any update, I have this habit of conducting a live test every year in August, wherein I will focus on only updated questions. Like if there is any change in that question, I'll try to put it there. If there is any change in the guideline, I'll try to put it there, so that if you write this exam and go through model answer, that 5 to 6 marks difference from your competitor, you can definitely have an edge if you follow that live GT, which happens in August. Apart from that, try to finish all the scheduled tests. And I'm also planning, I have seen bright students missing on the diagnosis part in the last year, because there are hardly 2 to 3 questions based on diagnosis, which is critical, but overall 4 to 5 questions you need to diagnose it. So let's do some clinical scenario diagnosis challenges. I'll post it in the group. Okay, from PYQs, or I'll create some of the diagnosis based questions and I'll post it in the group. I want you to extrapolate it, what is the diagnosis and what is the differential diagnosis. At the end of the day, I'll upload a video discussion of that in the same group itself, the WhatsApp group, so that at least the confusing diagnosis DD part will be covered. That is the only confusing part in paper 2. And also from pediatrics part, diagnosis is becoming difficult because they're giving integrated question. The same child is having diarrhea and malnutrition and also immunization failure. There are multiple aspects in the similar clinical scenario. So as we go along, IMNCA guidelines are becoming more and more important in management of pediatric clinical questions. That way, I think, and also dermatology is also, they are upgrading the level of the question. Previously they used to ask simple questions, but now look at the weightage dermatology has got. Almost 40 marks weightage is there with dermatology, so they're referring standard books for that. So I'll try to post some of the questions based on this diagnosis and differential diagnosis. And very importantly, as I said, not even 7% of the people are having images and all. I have decided to post at least 5 important images in the group on a daily basis. Just download that photo on a rough paper, try to draw that image on a daily basis. I'll try to post at least 5 important images per day in the next 100 days. I think happily you can finish off practicing 500 images. I think this should work fine, right, for you. I'll just, from the my UPSC Medico notes also contains a lot of images. You can practice that, but they are copyright images. I can't publish them outside. What I'll do is I'll copy them from the internet and I'll post it in the group. Just practice it on a daily basis, daily 5 images. Because in our optional exam instruction paper itself, they told us that you need to draw diagrams, use color pencils if needed. Dr. Anjali Garg used for histopathological images, she used hematoxylin and eosin pencil, and she was happy about that, and she told it in the interview. If she is using that, if someone else is not using it, definitely while pathology evaluation is going on, she'll definitely get 1 mark extra. At least she's following the basics of HP, right? Very rarely people use, very rarely people don't even know what is the color of cytoplasm or what is the color of the nucleus. Okay, so definitely these are very important. So this is what I wanted to do. I want to post some of the clinical questions to help you in diagnosis and differential diagnosis. I'll put all the updates in the live GT so that you're ready with the updates. And also we have test, discussion, everything, and also image practice session we'll do. I think these are the important things. Along with that, this active recall method, and also 5-day revision book. These are all the things that you have to mark as a checklist. Okay, paste it somewhere in your wall, or a preparation book, or a revision book, that I should do all these things for medical science. I think then you will be the winner. Okay, and I'll be ready to take your interview by next year. Okay, so we'll stop it here. Things are done. Yes, the schedule you already know. One more thing, what I want you to do is, before attempting pharmacology, try to look at the previous year papers, and also try to understand what is the essence of pharmacology, what kind of questions they're asking and all. Tomorrow what I'll do is, every week I will also give you what should I call it, strategy videos for particular subject. For example, if you're giving pharmacology test 3, this is how it goes. What I'm expecting you to learn from pharmacology. Nowadays, there are 2 things which are gaining importance. Okay, one is drug interactions. That's the reason in last 5 years you will see explain why aspirin with something else, or aspirin should not be given with warfarin, or explain why clonidine should not be given in hypertension. So these kind of questions are there, the trend. So you need to understand drug interactions within the syllabus. This is one area where there is no need to be focused. And you all know, as a UPSC aspirant, how important it is. The resistance of the drug, that too resistance to antimicrobial agents, is a global threat now. So they also expect you to know the resistance pattern of ATT, mainly the tuberculosis drugs, or Kala-Azar drugs, because there are lot many areas wherein we are trying to eliminate Kala-Azar, but sodium stibogluconate cannot be given in India because there is resistance. Similarly, typhoid is a major problem, but you can't give chloramphenicol and fluoroquinoline because there is resistance. So drug resistance is gaining more important. So these are the 2 areas I need you to focus. Though in the syllabus they mentioned only side effects and mechanism of action, they are asking questions in this area. So when you open UPSC Medical YouTube channel, and when you open understanding syllabus, there is one video. And when you open UPSC Medical YouTube channel, and there is one more thing, that is digital focus guide video. In the focus guide, I did talk about what are all the important things that should be read from a particular subject. Please focus on those areas. Okay, anyway, I'll also try to upload 10-15 minutes little small videos about each test. Maybe today I'll upload pharmacology because you have 1 week. Next week I'll upload on anatomy and physiology. What are the key areas that you should focus upon, and what can be anticipated and all. We'll try to include that. Okay, so these are all the things that I wanted you to tell. So now you can either use chat box to ask any specific question, or you can unmute yourself and ask any specific question, or if you have any personal strategy related things, you all have my number. Okay, feel free to ping me. Yes. Yeah, you can start with micro only, but see, my job becomes easy when I have all papers of a single subject. Because even I need to switch my brain from one subject to other subject. Then the same paper which takes 1.5 to 2 hours might take 3 to 4 hours to do a detailed analysis. I'll be obliged if you follow the schedule which is given in the thing. If not possible, it's okay. Like if you're comfortable with starting one subject, you can happily go ahead with that. Yes. It's only my comfort. If all of you submit on a single test, I can look into multiple papers and give you better analysis. And also I can compare your answers with the topper. Yes. Leukemia part of patho syllabus, don't worry about all the latest classifications. In the last 20 years, what I observed is in the leukemia, they're only focusing on chronic myeloid leukemia only. Because even AML, there are a lot many changes happening in the classification. We used to have FAB classification, then we have WHO classification, which is even difficult to memorize and teach from my end. Okay, Yeah, so that way, leukemia, just focus on AML, CML. That's it. Acute myeloid leukemia, chronic myeloid leukemia. Lymphomas is not in the syllabus. Only leukemia is there in the syllabus. Leukemia is also there in the pathology and also the very own general medicine. Not many questions have come from leukemia except chronic myeloid leukemia, clinical features and management, because we all know CML has that characteristic Philadelphia chromosome. And one question has come from AML M3, which has PML RAR alpha. Retinoid is useful in treatment. These are all breakthroughs in the modern medicine of pathology. So that's the reason they are very important. Yes. Any selection? Yeah, major mains preparation in 3 months. That is actually the new trend nowadays, because prelims is being so unpredictable. Most of the students, they are starting prelims from January itself. So in the process, they are unable to find time to practice mains. So if you do extensive prelims preparation, most of the subjects, they match with general studies, right? So if you can practice papers thoroughly and diligently in the next 100 days, I think you can definitely perform well, and people have done it. Okay. And you look at most of the interviews, when I ask them, when have you started answer writing for mains, they say only this 100 days. So this 100 days are crucial. Yes. Any particular resources for latest? Nothing much changed, Isaac. And whatever you need is already posted in the UPSC article section of the blog section of UPSC Medical website. That much is enough. From national programs, just think about what is happening with national programs. Let's say one important thing that is happening is nutritional programs. Okay, India is focusing more on nutrition because the ruckus happening around the global hunger index. Okay, India is falling short every year, and even Bangladesh is ahead of us. So this has become a headache for the Indian government. So that's the reason nutritional programs has gaining important, and even that anemia Mukt Bharat question has come even in prelims now. Okay, National Nutritional Prophylaxis Program. All these are important. Nutritional programs, anemia related programs is the major focus. You might expect questions. TB is always a champion. All the latest TB updates, I have posted a nice article there. Today itself in the my WhatsApp, I posted menstrual hygiene scheme, because we are focusing more on youth health because of the GS20 which is happening. So any program related to adolescent is important. Any program related to mother and child, Vande Mataram scheme, which has come in the last year, UPSC CMS, UPSC CSE, even the prelims question, last prelims, Vande Mataram scheme. So these kind of things, maternal and child health schemes are happening. And any change in that's it, because we have moved out of infectious diseases. We don't need to worry more about polio and all nowadays, because we have eliminated. But if you want to focus on Kala Azar, because Kala Azar is under radar of the government, because they want to eliminate it. That's it. These are the 5 important things that you need to focus: MCH programs, mother and child health programs, Kala Azar, TB, anemia related programs, and nutritional programs. All the updates are covered in the notes, and also I have covered them in the article or blog section of UPSC Medical. Yes. Yeah, that's why I created a group to prioritize the evaluation of you students. Okay, we have 67, I think, currently. So you will be prioritized. You will get your evaluation on time. Don't worry. Yes. Drug interactions, wherever possible, I did cover them in the notes. Check notes, Pradeep. And also this test, the pharmacology test 3, which is going to happen, I kind of pushed a lot of questions in the drug interaction section. If you can just attempt this test and go through model answer, I think that will enrich a lot of knowledge on the drug interaction part of pharmacology. That the questions which are given in the whole paper are fine. Whole paper in the sense, I have seen students attempting 5 out of 8 questions and only revising those 5 questions. The remaining 3 questions are also important to be revised. Okay. Yeah, I'll upload histology, histopathological images also as a part of image practice session. I'll do that. We already discussed about this, right, Jashan? List of cancers which must have to do staging. I'll post that status pic again in the group. Okay, what are all the TNM staging that you need to learn? Okay, yes, I'll help you with that TNM staging part. Yes.
Good evening, sir.
Yes, yes. Who is this?
This is Pradeep, sir. Dr. Pradeep.
Yeah, Pradeep, please tell me.
So for national programs, can we use GS knowledge? I mean GS topic, like can we write in optional subject? For example, it is TB program.
Yes.
There is National TB Control Program 2005 updated now. And
Yes.
there is we study regarding National TB program in GS3 and next one social issues. Can we use the same knowledge in the optional
Yeah,
paper?
yeah, definitely. Definitely. Again, balance is very important, Pradeep. I think one very important thing I observed is toppers who are in the list. I tell them to be more preventive doctors than curative doctors, right? They should be
Okay.
more preventive than curative. That in the sense, preventive in the sense, that's the essence of preventive medicine and national health programs. Now, what is the problem here is the paper setters, most of them, the questions match with UPSC CMS exam. Okay, combined medical service exam. So I used to tell all my students 2 years back only. Also practice last 5 years of CMS papers, at least the preventive medicine part. At least you will know what is happening with the preventive medicine part of development, because one or other question will get repeat from there. Now, when you look at this preventive approach and also current affair related approach, I haven't seen it bringing major difference, because most of the toppers starting from Akshita, Anshupriya, Diksha Joshi, and also Dr. P. Srija, who got All India rank 20, and even now you see Dr. Anjali Gag, their answers were never current affair oriented, nor they have no touch with preventiveness. They're more in the lines of history, physical examination, evaluation, flowcharts, algorithms. So what I preclude, see, I can't tell it as a dictum, but what I personally feel is you still need to be a good doctor. Like answers should be in the lines of medicine rather than more generalistic way, because it's a specialist optional, right? So wherever possible, try to be more specific about the demand of the question, but conclude your answer with something like current affair. That will definitely give them a sense that yes, you are a UPSC aspirant who is also into services. But will it bring any major difference to the scoring, or will it be an essential part? If you ask, I don't think it's a no, because if you start on thinking in such a way, you might lose specificity to your answers. Okay, think like a doctor while giving medical science. How is the
Okay.
patient, how he came, what investigation should I do, how to treat him, how to follow up him. Then, for example, I'll give you a nice example here. There's a question on scabies, prevention of scabies from dermatology. It's a pure dermatology question. A child has went to a school, he has developed lesions on the palms and school. In next 1 month, the whole school has got all these lesions, the students now. So what should be done to prevent it and all? These are the things, it is there in the questions, right? So it's a purely dermatology question wherein we have a preventive measures like cleaning the bedding, clothing, applying the scabicide. 1 day rest is enough. He can go to school the next day. And what are all the precautions to be taken in the school? This is a generalistic way of writing an answer, specific way of writing an answer from direct books. Like you can take Fitzpatrick, or you can take Harrison-based scabies, or you can take pediatrics, Nina Khanna's scabies discussion. In all this, they mentioned this preventive measures. But what I did in my model answer is I have also added that in RBSK program, among the 30 Ds, 30 diseases, scabies is also there. And in school health services, it is the duty of the doctor to check, duty of the school teacher to check for these lesions and report it to the medical officer. So when you can include that, I think this gives you a very good touch of understanding of primary health setup of India and what is the national health programs are doing. So when you club national health programs, try to club it from PSM based rather than a more generalistic ones. Okay, PSM based, you can
Okay.
definitely do it. RBSK
Okay.
program is there. Now you have to do screening for the scabies also there. It's included in that. Not many know that. So this is how you can look for it. But in the process of improvisation, don't lose the basic stuff. And I don't recommend it because you're already overburdened by a lot of things. Why do you need to think in a different dimension in next 100 days? So what worked for your All India rank 19, 16, 20 should also work for you. Okay, just think in their lines. Be more specific about your answer writing in medical science. Even questions are pretty specific. 2 marks, 3 marks, 4 marks, 5 marks. Hardly they're giving 10 marks to a question. So you don't need to worry about content here. Focus more on keywords and doctoristic approach, not generalistic approach. Yes.
Okay, sir. Thank you.
I think we're done with the questions part. Yeah. Yeah. This time the schedule, we have 7 days of schedule. Okay. After submission in 1 week, you'll get it. In general, test series is 2 weeks. I will prioritize all your papers, the 76 students who are part of this program. Okay. And completing paper with average answers. Yes, yes, definitely. You see, average, see, 240, 250 will not work for you. Okay. Please aim for 300 plus now. Okay. Change your mindset, change your attitude. It is possible, and it is up to you to make it possible. Okay, let's work it together. That extra 20-30 marks is on me. Just follow my guidance, follow my guidelines, follow my papers, practice them, write them, spend it's a game of balance. As I said, spend at least 300 hours for medical science optional. You will definitely score 300. Yes. Okay, then let's sign off. If there is any question, I'll wait for 2 more minutes. Then if you have any specific question, you have my number, you can WhatsApp me anytime. Yes.